Okay, what we have here is a sheep heart, and this is how you would see the sheep heart as if you were looking at the front of the sheep. This is the ventral view of the sheep heart, and if we examine the external surface of that heart, you'll see a lot of white here. This white is fat on the heart. You will see the brown here. This is cardiac muscle. This area right here that's covered by fat, underneath this runs the coronary artery, and there are additional arteries that then branch off of that coronary artery. And if you remember from your research, the coronary artery supplies the heart tissue with blood. Now we're going to take a view of the back side or dorsal side of the heart. And again, you've got your ventricles, you have your left ventricle, you have your right ventricle, you've got a lot of fat back here, and underneath this fat you have coronary artery on the back of the heart as well. Looking to the top of the heart, we have the right auricle, or also the right atrium. And actually the auricle is a ear-like flap that extends off of the right atrium, and this auricle allows the atrium to become larger in size when the atrium fills with blood. We have the left auricle, which leads into the left atrium, and that left atrium is covered by all of this fat. Okay, so what we've done here is we have made our cut into the heart, and we started over here on the right atrium. We went across the right atrium, across these vessels here, which we're going to get to in a few minutes. We continued over, cut into the left atrium, and around the heart into and down through the left ventricle to the apex or bottom part of the heart. And now I'm going to open this up, and we're going to we left some of the heart intact so we could unfold it. So what we're going to do now is we are going to trace the path that blood would follow as it flows through the heart. So the blood is going to be carried from the lower body and pass through this vessel here, which has been cut when this heart was removed from the sheep. So depending upon how it was dissected out of your sheep, you may or may not be able to locate this easily. So we have our inferior vena cava, and here we have our superior vena cava. These two vessels, the inferior vena cava drains blood from and collects blood from the lower extremities. The superior vena cava is going to collect blood from the head. This blood is going to flow into these veins, and from there go into the right atrium, which you're seeing here. I'm putting my finger there, and we've also made a cut into that so that you can see inside that chamber. Okay, so now we're going to open this heart back up. You have here the tricuspid valve, remnants of it, and this tricuspid valve is what regulates the blood flow between the atrium, the right atrium, and the right ventricle. It's what keeps blood from backing up into the right atrium when the right ventricle contracts. Passing now into the right ventricle. And notice that the cardiac muscle that composes the right ventricle is the wall. The walls are much thinner than we're going to see later when we get to the left ventricle. Okay. Okay, so now we're back in the right ventricle. Through the right ventricle, the blood will flow into the pulmonary arteries, and again, notice the artery has a much thicker wall than what we saw with the veins. So our blood is going to go to our lungs, it's going to pick up oxygen, it's going to drop off CO2, and then it is going to come back to the left side of the heart, and it is going to enter the left atrium via the pulmonary veins. Okay, and we have our pulmonary vein, and again, because of the way that this heart was dissected out, we've just got a little bit of remnant there of the vein. It's going to pass into the left atrium, then through the mitral, or also known as the bicuspid valve, into the left ventricle. Again, I'm going to kind of close it up so you can see left ventricle. So left ventricle here, the other side of the left ventricle. Okay, so we are in the left ventricle, and the left ventricle, when it contracts, it forces blood up and out through this thick-walled artery called the aorta. So I have a part of the aorta here, and because we cut across this heart, the other part of the aorta is on the opposite side. So when we bring that heart together, you can see where it forms that tube, that aorta. So again, let's open that heart back up, and we have the aorta, and off of the aorta we have the brachiocephalic artery, which is going to supply blood to the upper extremities. Okay.
Yeah. Okay. All right, so what we're looking at today is sheep heart, and we're looking at the ventral side of the sheep heart. We can see on this ventral side the apex of the heart at the bottom. When you orientate the heart, you're looking at it. The left side is actually the right side of the heart, and the right side of you is the left side of the heart. So up here, we have some flap-like structures. I'm going to turn the heart up. You can see that this is the right auricle or atrium, which is below that. Right here we have the right ventricle. Now the coronary artery is going to dissect the heart down the center. So on the opposite side of that, we have the left ventricle. And up here at the top, we have the left atrium and auricle, which is that flap-like structure. So again, this was the ventral view of the heart. We're going to flip our heart over. We're going to look at the dorsal side. On our dorsal view, again, we can see the coronary artery coming down the heart, again, bisecting the heart into two sides. We have the left ventricle, the right ventricle, the right atrium up here at the top. I've cut through that for later view. And then the left atrium up here on the top. So now we're going to follow the heart, the blood flow through the heart, and we'll flip back to the ventral side to go through that. All right, so we're going to open the heart up just to get a quick glance inside at what we're looking at. So we've taken the heart and cut it from the right atrium all the way down and around to the apex of the heart, making it open up like a book, but keeping part of the heart intact so that we can still put it back together to see what we're doing. So blood is going to flow into the heart through our vena cavas. You have a superior and an inferior vena cava, and they're going to flow into the right atrium. So I'm locating my right atrium up here. And on this, now I've flipped back to the dorsal side of the heart. You can see that there's two openings right here where I can put my finger through. Up top is the superior, down low is the inferior. And both of these are going to flow in to this atrium, and notice it is cut open so I can see where that is. So if we look inside, we don't have that view because we didn't cut through it. It might look different on your heart. We go through the right atrium. We're going to go into the right ventricle through the tricuspid valve. You can see remnants of the tricuspid valve as your finger goes through. And from this ventricle, then we are going to pump blood to the lungs to become oxygenated. So as that happens, I'm going to put my finger up through here as I kind of close my heart. And you can see this thick-walled vessel right there is going to be your pulmonary artery. So remember, artery stands for A, away from the heart. As the blood gets oxygenated, then it's going to come back into the heart to the left side, which remember is over here again. From the left side, it's going to come in through the pulmonary veins coming towards the heart. In this particular heart, the pulmonary veins have been pretty much dissected off, but I can go in. Notice I come into this, into the left atrium up here. You can go from the inside. You can see it coming out. Okay. The blood then passes through the mitral or bicuspid valve into the left ventricle. Notice that the left ventricle is a much thicker walled ventricle because it's pumping blood out to the whole body. Also notice these chordae tendae, which look like little, or what we call heartstrings. So again, see when we close the heart up, we are on that left side in that left ventricle. The last part would be the blood that is oxygenated from the left ventricle is going to pump out through the aorta. So we can close up our heart here and look at the top. We can see our aorta right here. Open it up again to see where that came from. It's pumping right. It's kind of hard to see. You're going to pump right up through here, and it's kind of dissected on both sides. Okay, notice there's also a flap right here. That's the brachiocephalic artery. Again, arteries go away from your heart. The aorta then pumps blood out to the rest of the body.